Welcome everyone on the fantastic world of Rezum. So this is the first time we are in Eastern Zone. We are introducing the minimally invasive treatment for surgical treatment for prostate, which is called Boston Scientific Rezum. This is a Boston Scientific manufactured original product, first taken up exclusively at Samaritan Medical, Surgical and Critical Care Institute. For your kind information, we did the first procedure also with the academic help of Boston Scientific around 2 months back, and subsequently we have done more than five cases, actually 6 cases, and all the patients are doing fantastic. The most advantageous point of this minimally invasive procedure is it is called procedure. It is not a surgery, because people panic when they listen that they have to undergo a surgery. Surgery means traditionally there will be pain, there will be bleeding, there will be a lot of discomfort, there will be a lot of heckles. You will have to take rest for a long period. Here comes the revolution of Rezum. Okay, in Rezum we do it under local anesthesia, that is only with lignocaine jelly infiltration. This is done ideally as a daycare procedure. You don't require a full anesthesia. This can be done in any size of prostate, but preferably within 80 cc of prostate, and there is hardly any chance of bleeding. There is hardly any chance of infection. Also, this procedure is finished within a span of 10 to 12 minutes, although even 10 to 12 minutes is a very long time. In our cases of 5 cases which we did at Samaritan Medical, Surgical and Critical Care Institute, we usually finish the procedure in 5 to 6 minutes. If you compare it with even a laser surgery for prostate, then it comes an average laser surgery takes at least 1.5 hours time with a full anesthesia support. Here you don't require any. The most important advantages of Rezum or Rezum therapy is that it preserves sexual potency of young gentlemen who are suffering from a prostate obstruction, and there is hardly or no risk of urethral injury or leakage of urine after the procedure. The procedure is done with help of a water vapor therapy. If you can concentrate on this device, there are 3 switches. There is a white switch, there is a blue switch, and there is a release button. So once I press this white switch for a longer duration, there is a needle which comes out from the apex. This needle hits the prostate like this, and then water vapor comes out at the temperature of 103 degrees Celsius. It is a heated water vapor. So what happens is that it's a complete natural process. It causes degeneration or exfoliation of prostate cells, just like the leaves fall out of the tree at the spring. So if once I press the release this white button for some time, the needle comes out, then I press the blue button, then the vapor starts hitting the prostate adenoma or the prostate which has been enlarged. Then this vapor is short, stays for 9 seconds, that is 1 to 9, and then it is done. Then there is a release button. If you press the release button in adult population, although this is a dry model, this needle will go inside. Again, usually 4 shots are required. As I have already told that this is a heated water vapor therapy. This causes natural falling of the prostate tissue and subsequent degeneration and shrinking of the prostate tissue. Enlargement of the prostate tissue causes urinary blockage, so subsequent shrinking of the prostate tissue actually relieves the urinary obstruction and the patient gets free. Patient can be discharged within the same day of the procedure, as I have already told, so it is classically called a daycare surgical procedure. This patient requires a bit of catheter to be retained, but that is nothing at all extraordinary. Patient can go back to work, patient can go back to any sort of job, even with strenuous jobs can be performed. Like if a pilot is there, he can actually fly a plane. If somebody with a doctor, he can perform his duties, surgeries. A finest worker can do his skillful jobs. So this is the beauty of Rezum, and I believe and I know that this is the future of modern minimally invasive prostate surgery. We are proud to introduce this machine first in the Eastern Zone exclusively at Samaritan Medical, Surgical and Critical Care Institute. Thanks to the Executive Director, Mr. Shaunak Rai, for giving us the opportunity, the surgeons, this niche surgery of the future generation. Thank you.